Hi, my name is Alex and this workshop is brought to you by Ethical Health Solutions, where healthcare solutions are ethically crafted. Welcome to Part 8 of Exploring Healthcare Ethics, a workshop for healthcare professionals. We'll explore the importance of ethical leadership in promoting integrity and accountability within healthcare organizations, discuss the role of healthcare professionals as advocates for ethical healthcare policies and practices, and reflect on our personal values and responsibilities as ethical leaders in healthcare. Ethical leadership is crucial in any field, but it holds particular significance in healthcare due to the high stakes involved in patient care and well-being. Here's an expanded explanation of the importance of ethical leadership. Key components of ethical leadership. Integrity. Ethical leaders consistently act in alignment with moral principles and values, ensuring their actions are consistent with their words. Integrity builds trust among staff, patients, and stakeholders, which is essential for effective teamwork and communication. Transparency. Transparency involves openly sharing information and decisions with stakeholders, ensuring that actions and intentions are clear. In healthcare, transparency is critical for patient trust, informed consent, and collaborative decision-making. Accountability. Ethical leaders take responsibility for their actions and decisions, owning up to mistakes and making amends where necessary. Accountability fosters a culture where everyone feels responsible for maintaining high standards, which is vital for patient safety and quality care. Impact of ethical leadership. Culture of trust. Trust is foundational in healthcare, where patients must rely on providers for their well-being. Ethical leadership builds this trust by ensuring that all actions are taken with the best interests of patients in mind, leading to greater patient satisfaction and adherence to treatment plans. Respect and collaboration. Ethical leaders promote respect among team members, valuing diverse perspectives and encouraging open dialogue. This respect facilitates better teamwork and collaboration, which is essential for handling complex cases and ensuring comprehensive patient care. Improved patient outcomes. When ethical standards are upheld, healthcare practices are more likely to be evidence-based and patient-centered. Ethical leadership ensures that patient care decisions are made transparently and accountably, leading to better health outcomes. Staff satisfaction and retention. Healthcare professionals are more likely to feel valued and respected in an ethically led organization, which increases job satisfaction and reduces turnover. High staff morale and retention contribute to a stable and experienced workforce, enhancing the quality of care provided. Organizational success. Organizations known for their ethical standards attract patients, staff, and partners who value integrity, contributing to the organization's reputation and success. Ethical leadership reduces risks associated with unethical behavior, such as legal issues and public scandals, ensuring long-term sustainability and trust in the organization. Practical applications of ethical leadership. Setting clear ethical standards. Developing and communicating a clear code of ethics for the organization. Ensuring all staff understand and are committed to these standards. Role modeling. Leaders demonstrate ethical behavior in their actions and decisions, setting a positive example for others to follow. Role modeling ethical behavior helps inculcate these values throughout the organization. Ethical decision-making processes. Implementing structured processes for ethical decision-making, ensuring all decisions are reviewed from an ethical standpoint. Encouraging staff to voice concerns and participate in discussions about ethical issues. Continuous education and training. Providing ongoing education and training on ethical issues and standards. Keeping staff updated on best practices and ethical dilemmas in healthcare. Fostering an open culture. Creating a culture where staff feel safe to speak up about ethical concerns without fear of retaliation. Ensuring that there are mechanisms in place for reporting and addressing unethical behavior. In summary, ethical leadership is foundational for fostering a positive and effective healthcare environment. It ensures that patient care is of the highest quality, staff are motivated and committed, and the organization thrives in its mission to provide exceptional healthcare services. Let's learn more about the characteristics of ethical leaders. Characteristics of ethical leaders. Integrity. Ethical leaders demonstrate honesty, fairness, and consistency in their words and actions. Empathy. Ethical leaders show empathy and compassion towards others, considering the needs and perspectives of all stakeholders. Accountability. Ethical leaders take responsibility for their decisions and actions, acknowledging mistakes and striving for continuous improvement. Let's take a few moments to think about the characteristics of ethical leaders, and then let's see if we possess those same characteristics. Time is up. Let's discuss the characteristics of ethical leadership. Ethical leaders possess distinct characteristics that set them apart and enable them to guide their organizations effectively while upholding high moral standards. Let's delve deeper into these characteristics. Characteristics of ethical leaders. Integrity. Honesty. Ethical leaders are truthful and transparent. They do not deceive or manipulate others and are upfront about challenges and mistakes. Fairness. They treat all individuals equitably, ensuring decisions are just and impartial. They do not show favoritism or bias. Consistency. Their actions align with their words, maintaining reliability and trust. They uphold the same ethical standards in all situations, fostering a stable and predictable environment. Empathy. Compassion. Ethical leaders genuinely care about the well-being of others. They show kindness and concern, especially during challenging times. Understanding. They strive to understand the emotions, needs, and perspectives of all stakeholders, including employees, patients, and the community. Supportiveness. They provide support and encouragement, helping others to achieve their best and addressing their concerns compassionately. Accountability. Responsibility. Ethical leaders take ownership of their actions and decisions. They do not shift blame to others and are proactive in addressing issues. Acknowledgement of mistakes. They admit when they are wrong and seek to make amends. They view mistakes as opportunities for learning and improvement. Commitment to improvement. They are dedicated to continuous personal and organizational growth. They seek feedback, embrace change, and implement strategies to enhance performance and ethical standards. Additional characteristics. Transparency. Ethical leaders are open about their decision-making processes and provide clear, accessible information to stakeholders. This openness builds trust and ensures that everyone understands the rationale behind decisions. Vision and ethical foresight. They have a clear vision of the ethical standards they want their organization to achieve. They anticipate potential ethical dilemmas and plan proactively to address them. Courage. Ethical leaders have the courage to stand up for what is right, even in the face of adversity or pressure. They are willing to make difficult decisions that uphold ethical principles, even if those decisions are unpopular. Humility. They recognize their own limitations and are open to feedback and new ideas. Humility allows them to learn from others and admit when they need assistance or when they have made a mistake. Respect for others. Ethical leaders respect the dignity and rights of all individuals. They foster an inclusive environment where everyone feels valued and respected, regardless of their background or position. Practical applications of ethical leadership characteristics. Building trust. By demonstrating integrity, ethical leaders build trust within their teams and with external stakeholders. Trust is essential for effective collaboration and organizational success. Enhancing team cohesion. Empathy and respect create a supportive work environment where team members feel understood and valued. This leads to higher morale, better teamwork, and increased productivity. Promoting accountability. Ethical leaders set a standard for accountability by modeling it themselves. This encourages a culture where everyone feels responsible for their actions and contributes to continuous improvement. Fostering transparent communication. By being transparent, leaders ensure that everyone is informed and involved in decision-making processes. This openness leads to better decision-making and increased stakeholder buy-in. Encouraging ethical behavior. Through their own actions and decisions, ethical leaders set a strong example for others to follow. This creates an organizational culture where ethical behavior is the norm and ethical dilemmas are addressed proactively. In conclusion, the characteristics of ethical leaders, integrity, empathy, and accountability, among others, are essential for guiding organizations in a manner that promotes trust, respect, and continuous improvement. These traits enable leaders to create positive, ethical work environments that benefit both individuals and the organization as a whole. Let's talk about the role of healthcare professionals as advocates. Advocacy for patients. Healthcare professionals advocate for the best interests of their patients, ensuring access to quality care, respect for patient autonomy, and protection of patient rights. Advocacy for ethical practices. Healthcare professionals advocate for ethical healthcare policies and practices, promoting transparency, equity, and patient-centered care within their organizations and communities. Now, let's have a few moments and think about the role of healthcare professionals as advocate. The time is up. Let us talk more about the role of healthcare professionals as advocates. Healthcare professionals play a critical role as advocates, both for their patients and for the ethical standards within their organizations and the broader healthcare system. Their advocacy efforts are vital for ensuring quality care, protecting patient rights, and fostering ethical practices. Here is a more detailed explanation of these advocacy roles. Advocacy for patients. Ensuring access to quality care. Navigating healthcare systems. Healthcare professionals help patients understand and navigate complex healthcare systems, ensuring they receive the necessary services and resources. Overcoming barriers. They work to remove barriers to care, such as financial constraints, geographical limitations, and cultural or language differences, ensuring equitable access for all patients. Respecting patient autonomy. Informed consent. Professionals ensure that patients are fully informed about their treatment options, including risks and benefits, so they can make autonomous decisions regarding their care. Empowering choices. They support patients in making choices that align with their values and preferences, respecting their right to self-determination. Protecting patient rights. Confidentiality and privacy. Healthcare professionals uphold strict standards of confidentiality and privacy, protecting sensitive patient information. Advocating against discrimination. They advocate against any form of discrimination or bias in healthcare, ensuring that all patients receive fair and respectful treatment. Patient safety. They actively work to ensure patient safety, identifying and addressing potential risks and adverse events in the healthcare setting. Advocacy for ethical practices. Promoting transparency. Open communication. Healthcare professionals promote open and honest communication within their organizations, ensuring that policies and decisions are transparent. Disclosure of information. They advocate for the disclosure of relevant information to patients and their families, fostering trust and informed decision-making. Fostering equity. Addressing health disparities. Professionals work to identify and address health disparities, ensuring that all patients have equal access to high-quality care. Inclusive policies. They advocate for policies that promote inclusivity and equity within healthcare organizations and the broader community. Championing patient-centered care. Holistic approach. Healthcare professionals promote a holistic approach to care that considers the physical, emotional, and social needs of patients. Patient involvement. They advocate for the involvement of patients and their families in care planning and decision-making, ensuring that care is tailored to the individual's needs and preferences. Practical applications of advocacy in healthcare. Policy advocacy. Healthcare professionals often engage in advocacy at the policy level, working with lawmakers and regulatory bodies to shape healthcare policies that promote ethical standards and improve patient care. Organizational advocacy. Within their own organizations, professionals advocate for practices and policies that uphold ethical standards, such as equitable hiring practices, fair resource allocation, and the implementation of evidence-based guidelines. Community advocacy. Professionals also engage with community organizations and groups to advocate for public health initiatives, access to healthcare services, and education about health and wellness. Examples of advocacy efforts. Patient advocacy programs. Establishing or participating in patient advocacy programs that provide support and resources to patients navigating the healthcare system. Ethics committees. Serving on ethics committees within healthcare organizations to address ethical dilemmas and ensure that patient care practices adhere to high ethical standards. Public health campaigns. Leading or supporting public health campaigns that aim to raise awareness about important health issues and promote healthy behaviors within the community. Legislative advocacy. Working with professional associations and advocacy groups to influence healthcare legislation, ensuring that laws and regulations protect patient rights and promote ethical practices. In conclusion, healthcare professionals, as advocates, play a vital role in shaping a healthcare environment that prioritizes the well-being of patients and upholds the highest ethical standards. Their advocacy efforts ensure that patients receive quality care, their rights are protected, and healthcare practices remain transparent, equitable, and patient-centered. By advocating both for individual patients and for systemic changes, healthcare professionals contribute significantly to the advancement of healthcare quality and ethics. Let's talk about ethical leadership in action. Case example. A healthcare administrator implements a whistleblower protection policy to encourage staff to report unethical behavior without fear of retaliation. Ethical consideration. Demonstrating commitment to transparency, accountability, and a culture of integrity through organizational policies and practices. Let us have a minute to think about how ethical leadership in action works. The time is up. Let us discuss the topic at hand. Ethical leadership in action can be illustrated through specific examples where leaders take deliberate steps to foster an ethical culture within their organizations. Here's a detailed explanation of how ethical leadership can be exemplified, using the case example of implementing a whistleblower protection policy. Case example. Implementing a whistleblower protection policy. Context and actions. Identifying the need. Recognition of issues. The healthcare administrator recognizes that unethical behavior can occur and that staff may be reluctant to report such behavior due to fear of retaliation. Assessing risks. The administrator assesses the risks associated with not having a formal mechanism for reporting unethical behavior, including the potential for harm to patients, staff, and the organization's reputation. Developing the policy. Policy drafting. The administrator works with legal and ethics experts to draft a comprehensive whistleblower protection policy that clearly outlines the procedures for reporting unethical behavior. Stakeholder input. Input from various stakeholders, including healthcare professionals, staff representatives, and patient advocacy groups, is sought to ensure the policy is robust and comprehensive. Implementing the policy. Training and communication. The policy is communicated to all staff through training sessions, informational meetings, and written materials. Staff are educated on the importance of reporting unethical behavior and the protections in place. Establishing reporting mechanisms. Multiple reporting mechanisms are established, such as anonymous hotlines, online reporting systems, and direct reporting to designated ethics officers. Ensuring protection and follow-up. Protection measures. The policy includes strict measures to protect whistleblowers from retaliation, including confidentiality provisions and assurances that reports will be taken seriously and investigated promptly. Regular audits and reviews. Regular audits and reviews of reported cases are conducted to ensure the policy is effective and to make improvements as needed. Ethical consideration. Transparency. Open communication. By implementing and clearly communicating the whistleblower protection policy, the administrator demonstrates a commitment to transparency. Staff are informed about their rights and the procedures for reporting unethical behavior. Visibility of actions. The administrator ensures that the outcomes of reported cases, while maintaining confidentiality, are communicated to staff, reinforcing the organization's commitment to ethical behavior. Accountability. Responsibility for ethical culture. The policy underscores the organization's commitment to accountability by holding all staff, regardless of their position, responsible for upholding ethical standards. Addressing unethical behavior. The administrator ensures that reported cases are thoroughly investigated and that appropriate actions are taken against those found guilty of unethical behavior, reinforcing the principle of accountability. Integrity. Commitment to ethics. By proactively addressing the potential for unethical behavior and protecting those who report it, the administrator demonstrates a strong commitment to integrity and ethical leadership. Consistency in actions. The implementation of the policy is consistently applied, ensuring that all staff are treated fairly and that the organization's ethical standards are upheld uniformly. Benefits of ethical leadership in action. Fostering a culture of integrity. Building trust. Staff are more likely to trust an organization that takes proactive steps to protect whistleblowers and address unethical behavior. Encouraging ethical behavior. Knowing that there are protections in place, staff are more likely to report unethical behavior, leading to a more ethical organizational culture. Enhancing patient safety and quality of care. Preventing harm. Unethical behavior, if left unchecked, can lead to harm to patients. A whistleblower protection policy helps identify and address such behavior before it can cause significant damage. Promoting best practices. An organization that values ethics and integrity is more likely to adhere to best practices and evidence-based care, improving overall patient outcomes. Strengthening organizational reputation. Positive public perception. An organization that demonstrates a commitment to ethical behavior through transparent and accountable practices is likely to enjoy a better reputation among patients, partners, and the community. Attracting talent. Ethical leadership can attract professionals who value integrity and want to work in an environment where ethical behavior is prioritized. In conclusion, the implementation of a whistleblower protection policy is a clear example of ethical leadership in action. It demonstrates a healthcare administrator's commitment to fostering a culture of transparency, accountability, and integrity. By proactively addressing potential ethical issues and protecting those who report them, the administrator not only upholds high ethical standards but also contributes to the overall success and reputation of the organization. This approach benefits patients, staff, and the community, underscoring the critical role of ethical leadership in healthcare. Now, let's talk about strategies for ethical leadership. Led by example. Model ethical behavior and values in your interactions with colleagues, patients, and stakeholders. Foster open communication. Encourage a culture of open dialogue, feedback, and transparency within your team and organization. Promote education and training. Provide opportunities for education and training on ethical principles, leadership development, and advocacy skills for healthcare professionals. Let us have a few minutes, then we can start our discussion with strategies for ethical leadership. The time is up. Ethical leadership is essential for creating a positive organizational culture and ensuring that healthcare practices are aligned with moral and professional standards. Here are more details on strategies for ethical leadership. Strategies for ethical leadership. Led by example. Model ethical behavior. Consistency in actions. Demonstrate ethical behavior consistently in all interactions, ensuring that your actions match your words. Decision making. Make decisions based on ethical principles, considering the impact on patients, colleagues, and stakeholders. Values and interactions. Respect and fairness. Treat everyone with respect and fairness, regardless of their position or background. Transparency. Be open and honest in your communications, sharing information and decisions transparently. Accountability. Owning mistakes. Acknowledge and take responsibility for mistakes, using them as opportunities for learning and improvement. Setting standards. Set clear ethical standards for your team and hold yourself and others accountable to these standards. Foster open communication. Encourage dialogue. Open door policy. Create an environment where team members feel comfortable sharing their thoughts, concerns, and feedback without fear of reprisal. Regular meetings. Hold regular meetings to discuss ethical issues, gather input, and address concerns collectively. Feedback mechanisms. Anonymous reporting. Provide avenues for anonymous reporting of unethical behavior or concerns, ensuring that staff feel safe in voicing their issues. Constructive feedback. Encourage constructive feedback and use it to make improvements in policies and practices. Transparency. Clear communication. Communicate clearly about the organization's values, expectations, and decisions, ensuring that everyone understands the rationale behind them. Information sharing. Share information about ethical dilemmas and the decision-making process, fostering an environment of trust and openness. Promote education and training. Ethical principles. Workshops and seminars. Offer workshops and seminars on ethical principles, ensuring that staff are well-versed in the foundational aspects of ethics in healthcare. Case studies. Use case studies and real-world examples to illustrate ethical dilemmas and appropriate responses. Leadership development. Leadership programs. Provide leadership development programs that include a strong emphasis on ethics, helping future leaders understand the importance of ethical decision-making. Mentorship. Establish mentorship programs where experienced leaders can guide others in ethical leadership practices. Advocacy skills. Training sessions. Conduct training sessions on advocacy skills, empowering healthcare professionals to effectively advocate for patients and ethical practices. Resource provision. Provide resources and tools that healthcare professionals can use to support their advocacy efforts, such as guidelines, best practices, and legal information. Practical applications of these strategies. Creating ethical guidelines. Develop and disseminate clear ethical guidelines and codes of conduct that outline expected behaviors and decision-making processes. Ensure these guidelines are easily accessible and regularly updated. Establishing ethics committees. Form ethics committees that can provide guidance on complex ethical issues, offer support for ethical decision-making, and serve as a resource for staff facing ethical dilemmas. Recognition and rewards. Implement recognition and reward programs that highlight and celebrate ethical behavior within the organization. Acknowledge individuals and teams who demonstrate outstanding ethical leadership and integrity. Regular ethical audits. Conduct regular audits to assess the ethical climate of the organization. Use the findings to identify areas for improvement and to reinforce the importance of ethics in all aspects of the organization's operations. Policy development. Develop policies that support ethical behavior, such as whistleblower protection, conflict of interest management, and patient rights. Ensure these policies are well communicated and consistently enforced. Benefits of ethical leadership strategies. Building trust. Leading by example and fostering open communication build trust between leaders, staff, patients, and stakeholders. This trust is essential for effective collaboration and patient care. Enhancing team morale. A culture of transparency and accountability leads to higher staff morale and job satisfaction, as team members feel valued and respected. Improving patient outcomes. Education and training on ethical principles and advocacy skills ensure that healthcare professionals are well equipped to provide high-quality, patient-centered care, leading to better patient outcomes. Strengthening organizational reputation. Consistently demonstrating ethical leadership enhances the organization's reputation, making it a preferred choice for patients, staff, and partners. Ensuring long-term success. Organizations that prioritize ethical leadership are better positioned for long-term success, as they can navigate ethical challenges effectively and maintain a positive, sustainable culture. In conclusion, implementing strategies for ethical leadership, such as leading by example, fostering open communication, and promoting education and training, is crucial for creating an ethical and effective healthcare environment. These strategies help build a culture of trust, respect, and accountability, leading to improved patient outcomes, enhanced team morale, and overall organizational success. By prioritizing ethics, healthcare leaders can ensure that their organizations operate with integrity and are well equipped to handle the complex ethical challenges that arise in healthcare. Now let's move on to advocacy for ethical healthcare policies. Case example. A group of healthcare providers advocates for policy changes to improve access to affordable healthcare for underserved populations in their community. Ethical consideration. Using their expertise and influence to advocate for social justice, equity, and the common good beyond individual patient care. Let's take a moment and think about advocacy for ethical healthcare policies. The time is up. Let us discuss the topic at hand. Advocacy for ethical healthcare policies is a critical component of healthcare professionals' responsibilities, extending their influence beyond individual patient care to address broader systemic issues. Here is an expanded explanation using the case example of healthcare providers advocating for policy changes to improve access to affordable healthcare for underserved populations. Case example. Advocacy for policy changes. Context and actions. Identifying the issue. Assessment of needs. Healthcare providers recognize that underserved populations in their community face significant barriers to accessing affordable healthcare, including financial constraints, lack of insurance, and geographical limitations. Data collection. They collect data to understand the extent of the problem, such as rates of uninsured individuals, health outcomes, and access to services. Forming a coalition. Collaborative effort. The providers form a coalition with other healthcare professionals, community organizations, patient advocacy groups, and policymakers. Shared goals. The coalition establishes shared goals focused on improving healthcare access and affordability for underserved populations. Developing policy proposals. Research and evidence. They conduct research and gather evidence to support their policy proposals, drawing on best practices, successful models from other regions, and academic studies. Specific recommendations. They develop specific policy recommendations, such as expanding Medicaid eligibility, creating community health centers, and offering sliding scale fees based on income. Advocacy campaign. Raising awareness. The coalition launches a public awareness campaign to educate the community and stakeholders about the issue and the proposed solutions. Engaging with policymakers. They meet with local, state, and federal policymakers to present their findings and advocate for the adoption of the proposed policies. Mobilizing support. They mobilize community support through petitions, public forums, and social media campaigns to build a broad base of support for the policy changes. Implementation and monitoring. Policy adoption. Following successful advocacy, the proposed policies are adopted and implemented by the relevant authorities. Ongoing monitoring. The coalition continues to monitor the implementation and impact of the new policies, ensuring they achieve the desired outcomes and making adjustments as needed. Ethical considerations. Social justice. Equity in healthcare. Advocacy for policy changes to improve access to affordable healthcare aligns with the principle of social justice, aiming to reduce health disparities and ensure equitable access to care for all individuals, regardless of their socioeconomic status. Addressing inequities. By targeting underserved populations, the coalition addresses systemic inequities that contribute to poorer health outcomes and limited access to care. Common good. Community health. Improving access to affordable healthcare benefits the entire community, leading to better overall health outcomes, reduced healthcare costs, and enhanced quality of life. Public health impact. Addressing barriers to healthcare access helps prevent the spread of communicable diseases, improves chronic disease management, and reduces emergency room visits, contributing to the common good. Professional responsibility. Expertise and influence. Healthcare providers have a professional responsibility to use their expertise and influence to advocate for policies that promote health and well-being. Their unique insights and experiences enable them to identify gaps in the healthcare system and propose effective solutions. Ethical obligation. Beyond individual patient care, healthcare professionals have an ethical obligation to advocate for systemic changes that address social determinants of health and improve the healthcare system as a whole. Practical applications of advocacy. Community engagement. Town hall meetings. Organizing town hall meetings to discuss healthcare issues with community members and gather their input and support for policy changes. Partnerships with local organizations. Collaborating with local organizations to amplify advocacy efforts and reach a broader audience. Policy development. Drafting legislation. Working with legal experts and policymakers to draft legislation that addresses identified healthcare access issues and incorporates best practices. Pilot programs. Implementing pilot programs to test the proposed policies on a smaller scale before wider adoption. Gathering data to support broader implementation. Educational initiatives. Workshops and training. Conducting workshops and training sessions for healthcare professionals on advocacy skills, policy development, and the importance of addressing social determinants of health. Public education campaigns. Launching public education campaigns to raise awareness about healthcare access issues and the benefits of proposed policy changes. Benefits of advocacy for ethical healthcare policies. Improved access to care. Affordable healthcare. Policy changes that make healthcare more affordable and accessible ensure that underserved populations receive the care they need, leading to better health outcomes. Preventive services. Increased access to preventive services reduces the incidence of severe health conditions and lowers overall healthcare costs. Enhanced community health. Health equity. Reducing health disparities contributes to a healthier community, with fewer individuals experiencing preventable illnesses and complications. Economic benefits. Healthier populations are more productive, leading to economic benefits for the community through reduced healthcare costs and increased workforce participation. Strengthened healthcare system. Sustainable practices. Implementing policies that address systemic issues creates a more sustainable and resilient healthcare system capable of meeting the needs of all community members. Increased trust. Advocacy efforts that lead to tangible improvements in healthcare access and quality build trust between healthcare providers and the communities they serve. Conclusion. Advocacy for ethical healthcare policies is a vital component of healthcare professionals' roles. By using their expertise and influence to advocate for social justice, equity, and the common good, healthcare providers can drive systemic changes that improve access to affordable healthcare for underserved populations. These efforts not only benefit individual patients but also enhance the overall health and well-being of the community, reinforcing the ethical foundation of the healthcare profession. Now, let's move on to the ethical leadership and organizational culture. Ethical leaders shape organizational culture by setting the tone, establishing norms, and reinforcing ethical standards through their words and actions. Discuss the impact of ethical leadership on organizational culture and the importance of aligning values with organizational goals and practices. Now, let's wait for a few seconds to gather our thoughts. The time is up. Let us discuss the topic at hand. Ethical leadership is pivotal in shaping and sustaining an organizational culture that promotes integrity, accountability, and trust. The influence of ethical leaders extends beyond their immediate actions to set the tone, establish norms, and reinforce ethical standards throughout the organization. Here is a detailed exploration of how ethical leadership impacts organizational culture and the significance of aligning values with organizational goals and practices. Ethical leadership and organizational culture. Shaping organizational culture. Setting the tone. Visible commitment. Ethical leaders visibly commit to ethical standards in their everyday actions and decisions. Their behavior serves as a model for others to emulate. Communicating values. Leaders consistently communicate the organization's core values and ethical principles, ensuring that these are well understood by all members of the organization. Establishing norms. Behavioral expectations. Ethical leaders establish clear expectations for behavior, outlining what is considered acceptable and unacceptable within the organization. Consistent enforcement. They ensure that ethical standards are enforced consistently, holding everyone accountable to the same rules and norms, regardless of their position. Reinforcing ethical standards. Recognition and rewards. Ethical behavior is recognized and rewarded, reinforcing its importance and encouraging others to follow suit. Ethical decision-making. Leaders make decisions based on ethical considerations, setting a precedent for others to do the same. Impact of ethical leadership on organizational culture. Building trust and credibility. Trust in leadership. When leaders act ethically, they build trust with employees, patients, and other stakeholders. This trust is crucial for effective teamwork and collaboration. Organizational credibility. An organization known for its ethical standards enjoys greater credibility and respect in the community, which can enhance its reputation and attract talent and partnerships. Enhancing employee morale and engagement. Positive work environment. An ethical culture creates a positive work environment where employees feel valued and respected, leading to higher morale and job satisfaction. Employee retention. Organizations with strong ethical cultures tend to have lower turnover rates, as employees are more likely to stay with an employer they trust and respect. Improving organizational performance. Ethical decision-making. Ethical leadership promotes sound decision-making that considers the long-term impact on all stakeholders, leading to sustainable organizational success. Risk management. By prioritizing ethics, organizations can better manage risks and avoid scandals or legal issues that can arise from unethical behavior. Fostering innovation and creativity. Safe environment. A culture of trust and openness encourages employees to share ideas and innovate without fear of unethical repercussions or retaliation. Diverse perspectives. Ethical leaders value diversity and inclusion, fostering an environment where different perspectives are respected and contribute to creative solutions. Importance of aligning values with organizational goals and practices. Consistency and integrity. Alignment with mission. Aligning values with organizational goals ensures that the mission and vision of the organization are pursued with integrity. This consistency strengthens the organization's identity and purpose. Unified direction. When values and goals are aligned, everyone in the organization works towards the same objectives, reducing conflicts and enhancing cooperation. Guiding behavior and decision-making. Ethical framework. A clear alignment of values with organizational goals provides a framework for ethical decision-making. Employees understand the guiding principles behind decisions, leading to more ethical outcomes. Clarity and guidance. Well-defined values offer clarity and guidance, helping employees navigate complex situations and make decisions that align with the organization's ethical standards. Enhancing stakeholder relationships. Building trust with stakeholders. Aligning values with practices ensures that stakeholders, including patients, employees, and partners, see the organization as trustworthy and reliable. Positive impact on community. Organizations that adhere to their values positively impact their communities, fostering goodwill and support from external stakeholders. Strategies to align values with organizational goals and practices. Leadership commitment. Leading by example. Leaders must exemplify the organization's values in their behavior and decision-making, setting a strong example for others to follow. Continuous learning. Leaders should engage in continuous learning about ethical leadership and practices, staying informed about best practices and emerging ethical challenges. Clear communication. Articulating values. Clearly articulate the organization's values and how they relate to its goals. Ensure that these values are communicated regularly through various channels. Feedback mechanisms. Establish mechanisms for feedback where employees can express concerns or suggest improvements related to ethical practices. Integration into policies and procedures. Ethical policies. Develop and implement policies and procedures that reflect the organization's values, such as codes of conduct, conflict of interest policies, and whistleblower protections. Regular review. Regularly review and update policies to ensure they remain aligned with the organization's evolving goals and values. Training and development. Ethics training. Provide regular training on ethical principles and decision-making to all employees, ensuring that everyone understands and can apply the organization's values in their work. Leadership development. Focus on developing ethical leadership skills among managers and future leaders to sustain a culture of ethics throughout the organization. In conclusion, ethical leadership profoundly influences organizational culture by setting the tone, establishing norms, and reinforcing ethical standards. By aligning values with organizational goals and practices, ethical leaders foster a culture of integrity, trust, and accountability that enhances employee morale, organizational performance, and stakeholder relationships. Implementing strategies that promote ethical leadership and value alignment ensures that the organization operates consistently with its mission and vision, contributing to long-term success and positive impact on the community. Ethical leadership is crucial in healthcare organizations as it fosters a culture of integrity, accountability, and excellence. By modeling ethical behavior, healthcare leaders set the tone for the entire organization, establishing norms that prioritize honesty, transparency, and responsibility. This approach builds trust among staff, patients, and stakeholders, creating a positive work environment where ethical practices are consistently reinforced. Such a culture not only enhances employee morale and engagement but also leads to improved patient outcomes, as decisions are made with a strong ethical foundation, considering the well-being of all stakeholders. As healthcare professionals, we have a responsibility to advocate for ethical healthcare policies and practices, ensuring that our values are reflected in our daily actions and organizational strategies. Leading by example, we must champion ethical leadership at all levels, promoting policies that ensure equity, fairness, and patient-centered care. This involves actively participating in policy development, continuous education on ethical standards, and fostering an environment where open communication and ethical behavior are encouraged and rewarded. By doing so, we contribute to a healthcare system that upholds the highest standards of ethical conduct, ultimately benefiting both the organization and the communities we serve. This is where this part ends. Please proceed to the next part and don't forget to share your thoughts with us. Leave a comment below or send us an email at info@ethical-healthsolutions.com with the subject line, feedback. Thank you. Alright, don't forget to subscribe and hit the bell button to receive notifications for new videos from us. Goodbye.